Ebola risk in the Democratic Republic of the Congo is now being described as very high, and the situation is becoming more serious by the day. The World Health Organization says this outbreak is centered in eastern DRC, especially Ituri province, where health workers are racing to track cases, isolate patients, and stop the virus from spreading further. This matters because Ebola is one of the most feared diseases in the world, and this latest outbreak is caused by the Bundibugyo strain, for which there are no approved vaccines or specific treatments yet. To understand why this outbreak is so alarming, you first need to understand what Ebola is. Ebola is a viral disease that spreads through close contact with infected bodily fluids, contaminated surfaces, or infected patients. It can move fast in areas where hospitals are overcrowded, testing is limited, and communities are already dealing with conflict or displacement. In the DRC, those conditions make containment much harder, which is why the WHO and the United Nations are moving supplies, personnel, and emergency support into the region as quickly as possible. The outbreak was first detected in eastern DRC and has since spread through several health zones, with reports also reaching neighboring Uganda. The WHO has said that the situation is more serious than the current numbers may suggest, because there are still uncertainties about the real size and spread of the outbreak. In other words, the cases we know about may only be part of the picture. That is one reason the WHO raised the risk level to very high inside the country, while keeping the regional risk high and the global risk low. So what does very high actually mean? It means the threat is serious enough that health agencies must treat the outbreak as a major emergency. The WHO has already declared it a public health emergency of international concern, which helps mobilize more resources, better coordination, and stronger cross-border monitoring. Officials are now focused on contact tracing, infection prevention, laboratory testing, safe treatment centers, and community engagement so that people understand how Ebola spreads and why early care matters. In outbreak response, speed matters because every delay gives the virus more time to spread. One of the biggest concerns is the local context. Eastern DRC has faced repeated Ebola outbreaks before, and the region is also dealing with insecurity, displacement, and weak health infrastructure. That combination makes it easier for infections to go undetected and harder for health workers to reach affected communities. Some reports say the number of suspected cases and suspected deaths has grown sharply in just 1 week, which shows how fast the situation can change. That is why authorities are asking communities to cooperate with health teams instead of hiding cases or delaying treatment. The global risk is still being described as low, but that does not mean the world can ignore this outbreak. Ebola outbreaks can create fear, strain border health systems, and test the ability of governments and aid agencies to respond together. The DRC has battled Ebola many times before, and each outbreak reminds the world how quickly a local health emergency can become a regional concern. For now, the main goal is clear: isolate cases, protect health workers, and stop the virus before it gains more ground.